Greetings everyone, David J. Coon with Qigong Awareness. I'm here with my buddy Keith. We're out here teaching some Qigong to you today in the park. Been getting a lot of questions about specifically leg pain. We've addressed some different joint pain issues, knee pain, hip pain, but now we're talking about the whole leg. Some people just really have a lot of leg pain. So as I expressed in some of my other videos, if you've watched some of those related to joint pain and so on, pain in the body is typically associated with what is called blood-qi stagnation. That means the blood and the qi are not moving very well. They're not circulating. If you can run, I'm sure you don't probably need this video, or maybe your legs are hurting from running. But either way, check this out. Keith and I are going to start marching. So some of you don't even walk. Maybe it hurts to walk, whatever the case may be. Your legs really hurt, and it seems easier to sit down on the couch, okay? If there are people out there who can run a 120-mile marathon or a 200-mile marathon these days, you can definitely get up off of your couch and work through some of your pain. I know you have pain and I know that it hurts, but I want you to understand something that I didn't understand back when I had a lot of back pain and different things that I had going on, and I got into Qigong and I learned about these things. So when your body gets really congested and we get this idea of blood-qi stagnation happening, things are getting stuck, nothing's moving, what we also get is we get this buildup of what is called lactic acid. Lactic acid, when it gets on the nerves of your body, and I won't go into all the details for now, but I'll just say, when it gets onto the nerves of your body, it hurts. It hurts. So when you first start moving, it's like, oh, it hurts, okay? But it is because the blood is not moving, the qi is not moving, and this lactic acid is like a poison in the body and it's built up in the tissues. You've got to find a way to move it. So if you cannot walk, then do this. If you have been running and your legs hurt and they're cramping and you ran a marathon yesterday, get up and start doing this even though it hurts like crazy, because you need to get the blood circulating. You also need to get the qi circulating. So this is a very good practice. Also, for those of you that don't know, the back muscle here on the back, the calf muscle, is called the gastrocnemius, is its fancy name, and this is actually considered a second heart in the medical world, because this back here pumps the blood from your legs back up to your heart. And guess what? It pumps it when you do this. So when you're walking like this, and one of the things that certain Qigong styles can do, they do a lot of stationary practice where they're not moving their legs like this. It's a lot of standing horse stances and other things. And this can have complications over time in your legs as well, because there's too much stagnation. There's not enough movement. Whereas in a class, like an aerobics class, you might be doing this, even faster. So we're making this a little Qigong-esque, and we're just using the pump factor here of moving the blood and getting things circulating, okay, in the legs. Now, what I like to do with this practice is we go from this marching business, okay, to a stationary, feet about shoulder width apart, which you won't do in your typical aerobics class. And then from here, I want you to just stabilize yourself. You can just put your hands out, make sure you're stable. Knees are slightly bent. And I want you to feel what's happening within your blood. I want you to feel what's happening within your saliva flow in your throat. Either the saliva is moving or it's not moving, because that is related to your digestion and whether your body is in a state of rest and digest or not. Now, one of the simplest Qigong exercises that we have, and I say often to the groups that I've been teaching for the last 30 plus years, is this waterfall practice where we exhale our breath, we come up and we inhale. I always say, don't forget this one. The water comes down and through the body. So you forget all your Qigong exercises, or you don't have much time, come back to this exercise we call the waterfall, because we want to image water coming down through, cleansing the body. And if you ever have the opportunity to do this in an actual waterfall, it feels fantastic. And then let the water wash over you. In Japanese, they talk about misoji, which is like purification rituals. highly recommended. But if you don't have the waterfall, the access to the actual waterfall, this is the practice here. Exhaling through the breath. This is an inhale through the nose. You're contracting your belly slightly here as you exhale. Also important note when you get down here to the bottom. Right there, when you finish your exhale, there's a second pause before you come up and inhale. Then exhale. Now, working with the overall legs, okay, we also come back to our Dao In practice, which is a tapping of the legs, tapping, moving the blood, circulating the blood and the qi, going down the outsides of the legs, coming up the insides, back down the outsides. And if you can reach here, just underneath the kneecap, if you can reach here, there's an acupuncture point roughly in this vicinity called 3 Mile Point. And if you tap it and you stimulate it, it was named this way because it can help you go 3 more miles. It's a point for energy. So tapping here, now you see where my head is? It's very important that when I go to stand up, I'm gonna stop, put my hands on my knees, bring my head back toward my trunk. In other words, I don't want to stand up with my head here and come up because that can give you a head rush. So when we're here and we're tapping like this, you see I'm looking at the camera, I'm looking up, and then from this position I'm going to use my legs to power up. If your legs have trouble doing that, then you can use your hands on your knees and help climb up to get that up. Now we're gonna go right back here to tap the hips. All right, and we also need to get into a little stretching. So we're gonna reach down toward the knees. We're gonna breathe in and out through the nose. If we can go a little deeper, we'll go a little deeper. Also, if we come back up, we place our hands on our hips here. I'm just gonna do one hand because I got a microphone here on my hip. I'm gonna stand in a horse stance and I'm just gonna elongate my right leg, shifting to my left with my left leg bending. I'm gonna stay here, 2, 3, 4, 5, 6. Now I'm gonna go to the opposite direction. 1, 2, 3, 4, 5, 6. I'm gonna go the other direction. 1, 2, 3, 4, 5, 6. I'm gonna shift the other direction. Some of you, if you're flexible enough, you can actually hang out down here. 2, 3, 4, 5, 6. If you can't yet, just use both of your hands or one of your hands to hold this position here. It's also a cheat because if your legs are having issues, this helps hold you up. Like, make this long, lock it out, and help hold that up, okay? And then come back to the center, tap your legs out one more time, and go down. And one more time, marching like so. Last but not least, I recommend that every single day you elevate your legs. If you can get your butt up against the wall to where your legs are completely vertical like this, I recommend that as long as you don't have heart issues, because those of you who are dealing with blood clots and things like that, you don't want to elevate your legs that high. But as far as you know, if you're healthy, then I recommend that version. Otherwise, a slightly less of an incline, just put your legs up on some pillows, get your legs up above your heart so that the blood can flow back to your heart, all right? For more Qigong practices, go to our website, check out our 21-day Qigong challenge, and challenge yourself. Not too hard of a challenge, just a little bit. 10 minutes a day, build up to it, all right? Check it out. See you in the next video.